Hi, I'm Jordan, and I recently received my once-weekly single-dose SAPHNELO pen prescribed by my doctor. This is what the SAPHNELO pen box looks like. Your pens will arrive in a bundle of 4, but we only need 1 pen for today's injection. Don't forget to put your extra pens back in the refrigerator. If it's your first or even second time injecting SAPHNELO, you may be a little nervous, and that's okay. I'm here to show you how it's done and to help give you a boost of confidence so you can feel more comfortable doing it on your own. Inside the box, you'll find the pen along with the instructions for use. Before using your SAPHNELO pen, your healthcare provider should show you or your caregiver how to use it. Be sure to read the instructions for use and the full prescribing information before injecting. And if you or your caregiver still have questions, talk to your healthcare provider. If you haven't read the instructions for use, please pause the video and do so now. Now that you're familiar with the instructions for use, this is what the pen looks like. I'll show you more about the pen in just a bit, but first let's chat about how to store it. Follow me. First thing you should know is how to store the pen. The pen should be stored in a refrigerator in the original carton to protect it from light until you're ready to use it. It can also be stored at room temperature for up to 7 days if you're away from home or traveling. Do not shake the pen or use the pen if it's been frozen or exposed to heat, if it's been dropped, damaged, or appears to be tampered with. Take 1 pen out of the refrigerator 60 minutes before you're ready to inject, allowing it to come to room temperature. I planned ahead and took my pen out earlier while I took care of some things around the house. And it's been 60 minutes. That means the medicine is ready. Next, I double check that I have all the supplies needed for the injection. The pen, an alcohol wipe, cotton ball or gauze, a bandage, and a sharps container. Keep all of your supplies in one spot, like a basket, so they're easy to grab each week. With my supplies ready, I'm going to inspect the pen. Look for the expiration date and any signs of damage. Check that the medicine is clear and colorless. If it's slightly yellow, that's okay. You may also notice small air bubbles. That's normal. Don't try to remove them. The medicine should not be cloudy, discolored, or contain any visible particles. Do not use the pen if the expiration date has passed. This pen looks good. Next, it's time to choose the injection site. If injecting SAPHNELO by yourself, you have the option to inject in the stomach or upper thigh. But if someone else is injecting it for you, like a friend or family member, they can also inject in your upper arm. Remember to choose an injection site that is at least 1 inch away from where you last injected, and avoid any scarred or damaged skin. Today, I am choosing the stomach for my injection, and I'm being careful not to inject into the 2-inch area around the belly button. Remember to wash your hands before your injection, and to clean the injection site with an alcohol wipe. Do not blow on it or touch it after cleaning. Okay, I'm ready to inject. Start by pulling the cap straight off. Do not recap the pen. This pen is now ready to use. The green needle guard is visible. Be careful not to touch the green needle guard or the needle inside. Now, position the pen 90 degrees to the injection site. Place the needle guard flat against the skin and make sure you can see the viewing window. You'll be able to watch the green plunger move during the injection. Press and hold the pen down firmly against the skin for 15 seconds, about the time it takes for 3 deep breaths. Do not move or reposition the pen. Listen for a click. That means the injection has started. If you don't hear a click, don't worry. You can check and see if the green plunger is moving down the viewing window. If it is, that means the injection is working, and you can continue to hold the pen down for 15 seconds. Listen for a second click. which lets you know the injection is almost done. Be sure to hold the pen down for the full 15 seconds. All right, that's time. Always check the viewing window to make sure all the medicine has been injected. You'll know the injection is complete when the green plunger has filled the viewing window. Now you can lift the pen straight up. The green needle guard will slide down and lock into place over the needle. A small amount of blood or liquid at the injection site is normal. If needed, press a cotton ball or gauze on the area and apply a small bandage. The final step is to dispose of the used pen in an FDA-cleared sharps disposal container right after use. If you don't have a sharps disposal container, you can use a household container, like a laundry detergent bottle, that is made of heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid without sharps being able to come out. Upright and stable during use, leak-resistant, and is properly labeled to warn of hazardous waste inside the container. I hope I've helped you feel confident about injecting SAPHNELO on your own. If you have more questions about the SAPHNELO pen or how to inject SAPHNELO, you can talk to your healthcare provider or visit saphnelo.com. Stay here to learn about the important safety information for SAPHNELO. Important safety information. Do not use SAPHNELO if you are allergic to anifrolumab-fnia or to any of the ingredients. Before you receive SAPHNELO, tell your healthcare provider about all of your medical conditions, including if you think you have an infection or have an infection that keeps coming back, are scheduled to receive a vaccination, or if you think you may need a vaccination. You should not receive live vaccines during treatment with SAPHNELO. Have or have had cancer. Are receiving other biologic medicines or monoclonal antibodies. Are pregnant or plan to become pregnant. It is not known if SAPHNELO will harm your unborn baby. Tell your healthcare provider if you are, might be, or plan to become pregnant during treatment with SAPHNELO. Pregnancy Exposure Registry monitors pregnancy outcomes in women exposed to SAPHNELO. You can find out more information about the registry by calling AstraZeneca at 1-877-693-9268. Are breastfeeding or plan to breastfeed. It is not known if SAPHNELO passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. SAPHNELO may affect the way other medicines work, and other medicines may affect how SAPHNELO works. SAPHNELO may cause serious side effects, including serious infections. SAPHNELO can lower the ability of your immune system to fight infections. You may be at a higher risk of developing respiratory infections and shingles, herpes zoster, during treatment with SAPHNELO. Infections could be serious, leading to hospitalization or death. Tell your healthcare provider right away if you have any of the following symptoms of an infection: fever, sweating, or chills, muscle aches, cough, shortness of breath, burning when urinating, urinating more often, diarrhea or stomach pain, warm, red, or painful skin or sores on your body, allergic hypersensitivity reactions, including anaphylaxis. Serious allergic reactions can happen during or after SAPHNELO administration. Tell your healthcare provider or get emergency help right away if you have any of the following symptoms of a serious allergic reaction: swelling of your face, mouth, and tongue, breathing problems, fainting or dizziness, feeling lightheaded, low blood pressure, cancer. SAPHNELO may reduce the activity of your immune system. Medicines that affect the immune system may increase your risk of certain cancers. The most common side effects of SAPHNELO include upper respiratory infections, bronchitis, infusion reactions when given intravenously, shingles, herpes zoster, cough. These are not all the possible side effects of SAPHNELO. Call your healthcare provider for medical advice about side effects. What is SAPHNELO? SAPHNELO is a prescription medicine used to treat adults with moderate to severe systemic lupus erythematosus, SLE or lupus, who are receiving other lupus medicines. It is not known if SAPHNELO is effective in patients with severe active lupus nephritis or severe active central nervous system lupus. It is not known if SAPHNELO is safe and effective in patients under 18 years of age. Please see full prescribing information, including patient information.